I think everyone has their own ideal of what beauty and like a perfect figure is, and I think with the Smart Lipo and getting the hourglass figure is just my personal opinion on a great figure, and that's what I really want to achieve from this.
Hello, good morning. Hi. Teresa, how are you?
Good, thank you. Nice to meet you.
Nice to meet you too. So how young are you?
28.
Okay, so how can I help you?
Well, I'm interested today in hearing about the Smart Lipo.
Okay.
Been going to the gym and I still see my stomach being my problem area, and that's where you come in.
Okay. The Smart Lipo actually was FDA approved in 2006.
Okay.
It adds a little bit of a change to the old traditional liposuction.
Mm-hmm.
The procedure that we do here is called TOPAL, or Tumescent in office power assisted laser lipolysis. I lectured that in 2007 with the American Academy of Cosmetic Surgery, mm-hmm. and we added a little bit of a modification, adding two devices that will contract the skin. Other than the laser, we use the micro-air power suctioning as well. So the procedure is about 3 hours.
Okay.
We do it in 3 phases. The first phase is the local numbing.
Mm-hmm.
So you get an injection locally in the tissues, like the dentist give you a dental numbing.
Okay.
You're fully awake during the procedure, so we don't use IV sedation. You're responsive during the procedure, which helps,
okay.
to minimize the complications that in the past was associated with using general anesthesia. We're gonna make a 2 millimeter entry points at the areas which is already numb, and from these small entry points we'll be able to achieve numbing of the entire area. We're gonna leave her for about 20 minutes so the epinephrine will cause the effect of vasoconstriction, and she will have a deep local anesthesia. Mm-hmm. Anesthesia will block the pain, temperature, and touch sensation, but not the proprioceptive sensation or the motion. So you have to tell the patient you're going to feel vibrations of the micro-air cannulas when we're doing the suctioning. Vibrations are always worse around the bony prominences. Some people feel it's soothing, some people don't like it. So we'll see what type of patient Teresa is today. So the second phase is what I call massaging using the disruptor tool. And when we do the massaging, simply break down the bands under the skin. That makes the results much more even and make the suctioning much more effortless to the patient and to the surgeon. You're going to feel a little bit of vibration, okay? And especially around your bones, you might feel a little bit more. Once in a while, you might feel a little teeny pinch. If nothing is very painful, that would be good. If something is painful, just stop me, okay? So at this phase, we're actually suctioning the fat. And you can actually see the fat coming out through the tubing. Yes, the reason why we turn the lights down, because we'd like to see that beam here underneath the skin, because if we turn the lights on, we might not be able to see it clearly. Actually, Teresa today, as we saw in the operation, was an excellent patient. Most patients are very apprehensive about the procedure. We've done thousands of patients, and I don't remember any of the patients did not tell me they didn't sleep the night before, for which we sometimes prescribe some kind of hypnotics or sedatives for the patients. But when they come to the procedure itself and see how simple and patient friendly it is, they're just surprised by the ease of this procedure. As far as the numbing goes, she felt some pressure, some heaviness. During the suctioning, she felt some vibrations. And during the laser, there is definitely no pain whatsoever. Patients are amazed by the way they just walk out of the office on their own, and they can just return to normal activity like shopping or taking care of their household after 24 hours. We advise the patients just today for Teresa to relax and drink a lot of liquids and take it easy for the day of the surgery. But from tomorrow, once she dries out, she can go ahead and just be herself and go back to work or do her normal activities.
So I'm done now. It went actually a lot quicker than expected, and even though I'm all wrapped up in foam, you know, I got a glimpse of it in the mirror, and I'm really excited to see the results in 1 week when I come back to get it undone. So, can't wait.